This is Medcare Equipment Company's video on the Luna G3 BiPAP machine from 3B Medical. The BiPAP will do fixed pressure, spontaneous BiPAP with an inspiratory pressure and an expiratory pressure, as well as auto BiPAP, where the machine adjusts based on patient's needs. So this is the machine. I'm going to show you a few things. In the back of the machine, this door holds your filter. This spongy filter should be washed weekly, and you should get about 6 months use out of the filter. Let it dry, put it back in, and then close the door. Your tubing goes in the back of the machine, and the tubing has this connector to make it heated. So you just connect the tubing to the back of the machine, and then make sure your connector goes to the back. Your power supply also goes into the back of the machine, and you always want to be plugging it into a grounded outlet or use a surge protector. So that is the setup of your machine. And whenever you have it set up at home, you want it to be level or lower than the head of your bed. So don't put it high on a headboard. This is the main screen. Your water chamber is on the right side, and to open it, you get your fingers under the teeth and opens to a 90-degree angle. You want to be filling this with distilled water every night. You have your fill line right here, so fill it to the max line so that you don't go dry. It will not hurt the machine if you do go dry, but you'll be getting dry air coming in, so you want to make sure that it is nice and filled so that you are humidified throughout the night. And it just closes like that. Now, to remove the water chamber, you just have to get a little force, push down, and then the water chamber removes. So you are able to clean this, empty this every morning. Do not leave any water in and keep adding to. You want to add fresh water, so you can empty this every morning. And we recommend cleaning it with dish soap and water. You can also use 1 part vinegar, 3 parts water to clean your chamber. To get it back, you just kind of rest it on the side and then push down, and you'll hear it snap into place. Power button is on the top of the BiPAP, so whenever you are ready to wear it, you put your mask on and you hit your power button. You'll see the screen say starting at the top, and then you will see this screen. So your pressure is on the left side of the screen, as well as how much flow it takes to get to your pressure. You'll see a leak that monitors how much air is coming out around the mask. So you need to make sure you have a good seal on your mask in order to get your appropriate pressure. And then we have a ramp time countdown on the right side. And the screen does go black, so you just have to tap it or turn the knob to wake it up. The ramp time counts down how long it takes to get from your starting pressure to your set pressure. On the bottom of the screen, you'll see that you have your humidifier and heated tubing, and we have those set in automatic, which is what we start at for the most part. I will show you how to adjust that yourself. The ramp time, again, is at 30 minutes, which you can adjust anywhere from 5 to 60 minutes, and then settings are on the bottom right. To turn the machine off, you have to hold it a little bit longer, so hold down for about 3 seconds, and then your machine will turn off and you'll have these I-codes come up. Now, these QR codes are to scan into 3B Medical's app if you choose to download that. You can also see your usage summary if you scroll over to the right, and that just gives you all your settings and gives you your events, leaks, anything you want to look at for your data from the night before. Back to the home screen. I'm going to go over the menu screen here. On the left side, you do have a preheat option, so you can choose to heat up your water chamber before you put the mask on. It'll do a 30-minute preheat. It's not really necessary, but it is an option for you. The machine is quick about heating up, regardless if you use the preheat or not. On the next screen, you have accessories, and this just gives you an option of when you can change your accessories, and you can set to have reminders for each of these, the air filter, the tubing, and the mask, if you choose to replace those at the set time. The mask setting, so there's different mask types that you can set. You have a full face mask, a nasal mask, and nasal pillows. So you just want to set the appropriate mask that you're using so that the machine knows the type of resistance and leak compensation to give for each mask. You have a mask fitting test. If you're getting a lot of leaks on your mask, or if you just want to test your seal, you can run this and it will test your seal with your mask on to make sure that you have a good tight fit. The report screen shows you your usage. So if you look, you have a 1-day, 7-day, 30-day, 90-day, 182-day, and 365-day report. And that gives you all your data based on the time frame that is selected. iCode is for the 3B Medical app. Again, if you download the app, you can just scan this code and it will bring your data over to your app so that you can see how you're doing. And then iCode, sometimes we call and ask for a code so that we can enter your data into the web service. And the code comes in a 1-day, 7-day, 30-day, 90-day, 182-day, and 365-day report. So if you do not hook up to Wi-Fi, if you don't have Wi-Fi in your home, we may be calling you for these codes so that we can get your data transmitted, and then your compliance can be monitored to make sure that you are following through. Settings are things that you can adjust based on your preference. So most of the time, like I said, we do have the humidifier and heated tubing set in automatic. The machine is going to detect the environment that you're sleeping in, give you the appropriate amount of heat and humidity based on that room. If you want to take it out of the auto mode, you just click on it, and there is a level from 1 to 5 for your humidifier. You can also turn it to off if you choose to. So 1 would be the least amount of humidity, 5 being the most amount of humidity. In the automatic mode, the machine's going to adjust and give you the appropriate amount. If you go over to ramp time, you can change your ramp time again from, you can turn it off, 5 minutes, the whole way up to 60 minutes. And that is the time it takes to get from your starting pressure, which a lot of the times we set it for to make it as easy as possible for you to fall asleep. And then that's how long it takes to get from your starting pressure to your set pressure that you are prescribed from your doctor. There's an accessory reminder, again, to give you an idea of when you should replace each of those items. And then there's other things on here: screen brightness, screensaver, backlight. And then the big important thing is to connect to your Wi-Fi. So you want to go to this whenever you set up your machine, click on the Wi-Fi, find your home network, and you just click on the home network that you connect to. We'll just use our Medcare Equipment Guest one for this. So you will enter your password, and you just use the scroll to select the letters, enter your password, and then you want to hit the enter button down here to connect to your Wi-Fi. That way, every day, your data will be transmitted to our web service, and you don't have to worry about the codes or us calling you to collect those codes. But if you do not have Wi-Fi, you will probably be getting calls about giving us the codes. So the best way to do it is just connect to your Wi-Fi, and that way everything could be automatically stored. You have your date and time and a few other things on here about the machine, the model, the serial number, etc. So in this instance, you have your settings on the bottom. We have an IPAP of 12 and an EPAP of 6 in the spontaneous mode. If things were different, you would see those numbers at the bottom. And at the top, you have your humidity settings, your heated tubing settings, and then your date and time. Whenever you are connected to Wi-Fi, you'll see the signal up there that you are connected. And again, if it goes black, you just turn the knob to wake it up, and your screen will go black after about 15-20 seconds of not using it. As far as cleaning goes, your water chamber should be emptied daily. Again, clean with dish soap and water. Your tubing should be cleaned daily. There is a cool down that runs through the machine that cools the tubing, dries it out, removes any condensation or moisture. But the tubing can be completely submerged in water. So you can get a tub, fill it up with water and dish soap, and fully submerge your tubing to clean it out. Then whenever you want to dry it, just hang it over a shower curtain rod or doorknob, let it air dry, hook it back to your machine at night, and it'll be ready to go. And then the cushion of your mask, you just want to wipe that down daily, again with soap and water. 1 part vinegar, 3 parts water is an alternate cleaning method. Avoid bleach and alcohol, that destroys the plastics. And that is all you need to do as far as cleaning goes. Resupply is done through Medcare. Based on the insurance company, you can get different supplies. Every 3 months usually for a mask, tubing, 6 months for a water chamber, and cushions of your mask can be ordered monthly. Filters would be every 6 months. And that is the BiPAP machine from 3B Medical.